This is a big talker over the weekend. The Centers for Disease Control spent the weekend trying to clear up confusion over their latest mask guidelines.
This was not permission to shed masks for everybody everywhere. This was really science-driven, individual assessment of your risk. Now, that's the first step that we need to take in our guidance to understand what's the individual risk. And now we all need to work together, and CDC is hard at work now saying, what does this mean for schools, for travel, for camps, for businesses? But we needed this
big questions there. Dr. Rochelle Walensky making the rounds on the Sunday talk shows just days after announcing that fully vaccinated people no longer had to wear masks. Now, here to help clear up some of the confusion over mask usage is epidemiologist Dr. Syra Madad with New York City Health and Hospitals. Good morning, Dr. Madad. Thanks for being with us today.
Morning.
Morning. Thank you for having me.
All right, first of all, let's break it down. What has been the response on your end to these new mask guidelines? Have you been fielding a whole lot of questions or people saying, okay, it's a little confusing?
There's been a lot of questions. I think it's been seen first as a sign of positive news. Absolutely. We know that we were going to get to this point as fast as the mask ordinances put in place. We know that we're now at a place where, we have good science to back up, removing these ordinances. But I think the question remains, and there's still a lot of confusion and frustration for families, including, for example, I have children. I have a 1.5-year-old, a 3-year-old, a 5-year-old, and a 7-year-old.
Yep.
And families that are in my situation are asking, we have maybe both parents vaccinated, our children are not. How do we go about this? Vaccinated America, but with still high levels of community transmission. So there's a bit of both on both sides.
So what you just said, though, about the families, right? Because it's specifically going into the summer months where parents are going to be taking their kiddos places, right? What is the guidance from your medical perspective then on what to do when you're with your children going in somewhere and the parent is fully vaccinated?
Yeah, well, I think first for those that are fully vaccinated, and as we define fully vaccinated, if you were part of a 2-dose, vaccine regimen, meaning whether you got the Pfizer or Moderna, it's 2 weeks after your last dose, or 1 dose with the J&J and 2 weeks after you're fully vaccinated. And what this means is that, you're able to resume a lot of activities that you were before, with some exceptions, so you still have to wear a mask in hospitals and other congregate settings. But when it comes to unvaccinated individuals, and there's still about 40% of Americans that are unvaccinated, if you look at the stats today, what does this mean and how do we move about knowing that those 40% are still at risk for infection, severe disease, hospitalization, and death, and that also includes children. And so I think there's 2 ways to look about it. So if you have children, I think first it's also modeling good COVID safe behavior. Mm-hmm. I can't say not to wear your mask or to wear your mask if I'm not wearing it. My children are going to ask me, well, how come you're not wearing one? And so I think first, it's important for me to model that good behavior. And then second, if I'm going to take them into an indoor congregate setting like a grocery store, I'm going to still wear a mask. I think it's still important that we continue to wear a mask until we have very, very low levels of transmission all around the United States. So we're very, very close to being there. Prevalence is quite low.
Yeah.
But I think that having, wearing a mask in some of those certain situations where you're also trying to model good behavior is important. And I think the last thing is your risk tolerance, right? How much risk are you willing to tolerate?
Yeah, there's a lot of variables here, and I'm with you. I've got little kids, 2 and 5, and I cannot go into a place not wearing a mask and expect them to wear theirs, because they're definitely going to call me out on that. Yeah. But, when it comes to this, though, and you talked about, getting everyone vaccinated, where are we with this herd immunity, if you will, and are we ever going to get there to where we can see this bit of normalcy return?
Well, herd immunity is just a concept where you're trying to slow down the transmission as much as possible. And in the United States, do we need to reach herd immunity to get to a level where there's low rates of community transmission, new infections, hospitalization, and death? And the answer is no, because we're seeing that play out today. We're at very low levels of transmission, generally around the United States, and hospitalization continues to dip, and so do death. But, I think that as more vaccinations are expanded to other eligibility groups, so right now with Pfizer's expanded EUA to 12 and older, we know that de-escalation trials are ongoing for those younger than the age of 12. We may get there down in the future, but we're not there yet. But that doesn't mean that we can't resume pre-pandemic life once we have good rates of vaccinations and low levels of community transmission.
I just want to quickly go through some fact versus fiction then with the mask mandate, right? Because it will be up to the local and state officials to issue the mask mandates, which is why New York and New Jersey are kind of up in the air right now, saying, hold on, not so fast. So there has been this CDC saying that you're clear for air travel, but recommended only essential travel, right? So should you be getting on a plane? What is the message there for getting on a plane?
If you're fully vaccinated, then certainly you're able to resume many of those activities, getting on a plane, traveling. If you're unvaccinated or if you're in between, meaning you got your first dose and you're not fully vaccinated yet, I would continue to take precautions.
Wearing a mask.
Yeah, that's
And then real quick, because we're seeing so many stores like Costco, Walmart, Starbucks, Trader Joe's saying, you know what, you don't have to wear a mask in our store. With that many people unvaccinated, do you worry that there will be a rise in cases?
I do think because we still have a large population that is not vaccinated, we're relying on the honor system.
Right.
And are you asking, is everybody honorable? That's a question for all of us. But I do think that in those congregate settings, we should continue to wear a mask until we're able to get to very, very low levels of new infection rates and hospitalizations and deaths.
I'm with you there. Better safe than sorry.
Yeah.
All right, Dr.
Yeah.
Madad, thanks so much for joining us today, trying to break
Thank
down
you.
the fact versus fiction. We appreciate it.